New tonight at 11, COVID hospitalizations are surging nationwide tonight.
So what's happening at our local hospitals and statewide? Our Shannon Lilly asked the health leaders who are in charge. Shannon?
Well, Bill, doctors I spoke with say they continue to watch as more and more patients come into these hospitals. And they say it's disheartening because a lot of this could be prevented.
We actually, for a period of time, I remember having this very, very hopeful feeling. We reached a number of 0 in the Richmond market for HCA in terms of hospitalized inpatients with COVID.
Dr. Raj Malhotra is the director of critical care for Chippenham and Johnston Willis Hospital. He remembers the steady decline in COVID patients coming into their hospitals following a local and national surge in January.
It almost was like kind of a glimmer of hope, kind of the sun breaking through the clouds.
But now, he says that's rapidly reversed.
The numbers are most certainly higher.
Dr. Malhotra reports even more COVID patients are coming into their hospitals now than amid the winter surge, and most are unvaccinated. Over at the VCU Medical Center,
and that's paralleling this massive increase in Delta infections.
Dr. Michael Stevens, interim hospital epidemiologist, also reports an influx in COVID patients similar to the one seen in January. He says they're averaging 50 to 60 COVID patients hospitalized at any given time.
Can't urge people enough to be careful, mask especially in public, indoor spaces, and get vaccinated.
We're definitely seeing more hospitalizations. I mean, the hospitalization rate is surging up. Today, we're over 1,600 current hospitalizations around the state.
Virginia's vaccination coordinator, Dr. Danny Avula, says statewide that rate isn't as high as the January surge, but is comparable to the first wave of hospitalizations in April of 2020.
At the beginning of this pandemic, a lot of those individuals who were hospitalized were elderly folks with underlying conditions. Now what we're seeing is it's people who are under the age of 50 because folks above the age of 50 have largely been vaccinated.
New data from the VDH shows that upward trend among younger age groups. The bars in yellow representing children ages 0 to 19.
I think what will happen is we'll see this continue to surge through August and September. We'll come down on the other side of that peak in late September or early October. But then we'll have some pretty steady rates with probably a few bumps through the winter.
Yeah, and doctors are urging you to do your part. Right now, about 56% of the state is fully vaccinated. VCU's Dr. Stevens says that is not enough to prevent a severe strain on hospital systems come this fall when another wave of infections is expected to hit.